Hi everyone. Today we will discuss about cultural diversity. Introduction to UAE culture. UAE is a multicultural society. UAE are inhabitants of the Arab world who speak various dialects of the Arabic language and share the values and beliefs of the Arab culture. A basic understanding of the Arab culture, attitude, values, beliefs, and practices is important to be culturally competent. What is culture? Culture is a sum total of the way of living, includes values, beliefs, standards, languages, thinking pattern, behavioral norms, communication styles, etc. Culture refers to norms and practices of a particular group that are learned and shared and guide thinking, decisions, and actions. What is diversity? Diversity is a term used to explain differences between cultures, such as psychological, physical, social differences that occur among any and all individuals. Example, race, ethnicity, nationality, religion, economic class, age, gender, sexual orientation, mental and physical ability, and learning styles. Primary diversity includes nationality, race, color, religious beliefs. Secondary diversity includes socioeconomic status, education, and occupation. What is the population of UAE? Total populations of the UAE is 10.17 million. It includes 4.23% of Egyptians, 12.69% of Pakistanis, 27.49% of Indians, 5.56% of Filipinos, and 38.55% of others, and Emiratis are 11.48%. Cultural competency. To be culturally competent, a healthcare provider needs to understand his or her own worldviews and those of the patient, while avoiding stereotyping and misapplication of scientific knowledge. Cultural competence is obtaining cultural information and then applying that knowledge. This cultural awareness allows to see the entire picture and improves the quality of care and healthcare outcome. Need for cultural competency. Perception of illness and diseases and their causes varies by culture. Culture also influences how people seek healthcare and how they behave toward healthcare providers. Healthcare providers must possess the ability and knowledge to communicate and to understand health behaviors influenced by culture. Having this ability and knowledge can eliminate barriers to the delivery of the healthcare. So, aspect of UAE culture. So, religion, prayers, obligation, medications adherence. Doctors to explain the reasons for not getting medications and for all laboratory testing. During Ramadan, many patients resist to take medications. Waiting time and advices, complaints to treatment, preferences of doctors, male doctors or female doctors, death and destiny. Consider death to be a destiny decided by God. Social customs, seek elders for advice. Maternal and child health. Arabs in general do not approve having an abortion. It is an Arab traditions to circumcise newborn boys. Diet, Ramadan meals, type of food, meat, halal, etc. Responsibilities of healthcare workers. Learn and use a few phrases of greeting and introductions in the patient's native language. This conveys respect and demonstrates your willingness to learn about their culture. Tell the patient that the interpreter will translate everything that is said, so they must stop after every few sentences. When speaking or listening, watch the patient, note the interpreter, add your gestures, etc., while the interpreter is translating your messages. Reinforce verbal interactions with visual aids and material written in the client's language. Repeat important informations more than once and make sure the patient understands by having them explain it themselves. Always keep the reason or purpose for a treatment or prescription. Personal information may be closely guarded and will be difficult to obtain. Avoid saying you must. Instead, teach patients their options and let them decide. Example, some people in these situations would Male doctors should examine a female patient with the presence of another female healthcare provider. Ensure to have the waiting areas with the separations of female and male places, etc. Maintain privacy and confidentiality. The learn model. Listen to the patient's perceptions of the problem. Explain your perception of the problem. Acknowledge and discuss. Acknowledge and discuss differences and similarities. Recommend treatments and negotiate treatment. Healthcare provider interactions. In some cultures, it may not be appropriate to suggest making advanced care directives for dying patients or patients with terminal illness. This is the cultural equivalent to wishing death on a patient. Avoid saying you must. Instead, teach patients their options and let them decide. Skills and characteristics of cultural competency. Respectful to each other, willingness to share, risk change, and explore, open to each other's differences, understand the power of action and words, ability to recognize learning opportunities, possessing knowledge of oneself, having an attitude that different is okay or interesting, commitment, co-responsibility, cultural competent communication skill. Use inclusive language. Make no assumptions. Learn about each other's culture, generations, beliefs. Active listening. Learn about the client's culture. Explain what you want to do and why. Approach with engagement, openness, and with the willingness to learn. How do we get there? Manage the dynamics of differences. Make your leadership style based on the situations and people involved. Acquire institutionalized culture knowledge. Adapt to the cultural context of internal and external communities they serve. Be aware that diversity, inclusion must be a business interactive and not an HR initiative. Casually linked to mission success. Reinforced and measured. 5 essential elements. Valuing diversity and understanding what cultural diversity truly represents. Having the capacity for cultural self-assessment. Being conscious of the dynamics inherent when cultures interact with patient-centered care. Acquiring institutionalized cultural knowledge, polished through cross-cultural encounters. Develop adaptations to rural health services delivery, reflecting an understanding of cultural diversity. Thank you.